So, good morning and welcome to this morning session on One Health. So, I guess you're all One Health aficionados. And the first question from my side is, how many of you were present last year when we also had a session on One Health? Okay, but not not in this room. Okay, well, so that's splendid because I was a bit concerned that some of you would have this "I've heard all this before" feeling. But I think we have made progress since last year. So great to see you all here. And I think we all know what we will be discussing in the hour or 1.5 hours to come. It's a very important issue, and that is how we ensure that we have the One Health aspects in focus when it comes to education, research, and not least governance. So great to see you all here. My name is Ole Petter Ottersen. I'm trying to chair this session. I'm presently based at University of Oslo, but I served as president of Karolinska Institutet until last year, now stepping down in 2023. And I'm also affiliated with Charité here in Berlin. So I'm very happy to be here alongside a very experienced panel. So we will be able to look at the One Health perspective from so many different angles. So I'm really excited about this. So I will try now in the very beginning to set the scene, so to speak. And I will do this through a short presentation. And the very first issue is how to define One Health. And I shan't dwell on this issue because I think we have a perfect definition of One Health from the panel that has gone deeply into this matter, the One Health high-level expert panel, OLEP. And the most important, I think, aspect of the definition of One Health is the second point here, that the One Health concept recognizes the health of humans, domestic and wild animals, plants, and the wider environment. And the interdependence or interconnectedness, I think these are key words in the discussion to come. We are so interconnected as human beings with the animal life, with the health of the planet, and we are also, of course, interconnected geographically. And this leads me to what will be an essential element here. We will walk around our planet, so to speak, to gather information, news about the status of One Health in different parts of the world. So I think it's fair to say we are here at a truly global occasion with several continents represented. Yes, so indeed, we are interconnected, not least to the animal, the realm of animals, the wildlife, but also, of course, domestic animals. And this report, I think, is highly relevant. It came out in July, and it tells us about the interconnectedness when it comes to health and disease with animals. And in fact, one key figure is that WHO states that more than 70% of all emerging infectious diseases will come from animals eventually, zoonotic diseases, interconnectedness. And, it's very difficult. Karin Sipido is here, and we just discussed this, Karin, just prior to this meeting. It's very difficult to really make all political decision makers understand how important it is to have the health-climate nexus in evidence when we discuss governance, when we discuss research. And some of the political decision makers in Europe, for example, or in North America, they say, okay, the climate impact on health, that's something they struggle with in other parts of the world. Not so. Look at this recent report. Here it claims more than 175,000 lives annually in Europe. That's what the latest data shows. So, the climate health nexus is highly relevant for all continents on Earth. And then, as I said, we are interconnected to the health of the planet. And this is a report from last year with Johan Rockström as the senior author. And as you all know, we are outside the safe operating space for humanity in many different arenas. So we have to connect the health of the planet to the health of the human being. And I'm very proud to say that the Virchow Prize this year was awarded, in fact, to two scientists who have tried and succeeded, in fact, in coupling human health to planetary health, Lucy Gilson and Johan Rockström. And perhaps you have seen this figure that is from the publication I just talked about last year, with Johan Rockström as the senior author, and we are, as I said, outside of the safe operating space when it comes to 6 of the 9 planetary boundaries. But look at the blue arrow. Fantastic. Ozone depletion. We are within the safe operating space when it comes to ozone in the atmosphere. And why? Why? Because of research. I'm an academic, many of you are academics. In fact, research is there to solve some of the pressing challenges that we have. When it comes to the ozone hole, you will remember, at least some of you, that in the 80s, this was seen as one of the major challenges, global challenges. But then research understood why is it that ozone was depleted. We had the Montreal Protocol, so we could get rid of these CFCs, fluorinated carbon substances that destroy ozone. And this led also then to a Nobel Prize for these 3 scientists that were at the front when it came to understanding the ozone depletion challenge. So these 3 scientists got a Nobel Prize for their work in 1995. So the message is research is important and can address some of the challenges that we are facing. A very recent report from last week, in fact, and I must say it made a huge impression on me. It tells you again about the interconnectedness. In this report, it says now that the wildlife populations have plummeted by 73% since 1970. 73%. We are interconnected with animal life for good, but also for bad, I would say. This is an effect of human interventions on our planet Earth. So one of the challenges that we see, and we just published a paper on this, is data. We have to have data from all 3 domains, the planetary health domain, animal health domain, and human health domain, in order to understand what is going on, in order to understand our interconnectedness. And here is a major challenge, because when we try to assess data from all these different domains in Africa, we could see that, well, these data are difficult to come by, and they are difficult to structure for One Health governance. So this will also come to the fore in this discussion today. So what will be addressed today? Well, One Health in education, One Health in research, One Health intelligence or surveillance, if you want, how to access and structure data that I just talked about. And also, on top of it all, we have to have One Health governance to connect the different domains, to find the best entry points for political decisions when it comes to One Health. And things are happening. Things are happening. We should not be pessimistic. In May, and I was in Brussels at that time, different agencies that are in charge of the different sectors that we're talking about here, animals, human health, planetary health, climate, they decided to join forces to see how we can look at health in a One Health perspective. So I would like to end with another Nobel laureate. Could you guess who? I mentioned three in chemistry. Oh, come on. Bob Dylan. Bob Dylan, Nobel Prize in Literature, because he said it all, times they are changing, and they must change. We have to have One Health governance in place, and One Health research in place, and One Health education in place. This is what this session will be all about. So then it's my pleasure to introduce the first speaker. and I hope that she will be on the screen very soon. Good morning.
Good morning.
The first speaker is from Africa, Senegal, Ava Maria Kolsek, former health minister, state minister, but now also president of the Ghanaian African Forum. And we are really looking forward to what you have to say about Africa and its efforts to enter the One Health area. And I should add, I've been to Africa several times recently, and Africa is, in many respects, leading the way when it comes to putting human health into the One Health perspective. Please, the screen is yours.
Thank you, Mr. Chair. Dear participants, good morning, everyone, and warm greetings from Senegal. For Africa, the establishment of a global network of one sustainable health institutes, crucial intersectorial platform for global health, presents both formidable opportunities and immense challenges. We are at the crossroads where the interdependence of human, animal, planetary health and development must be addressed simultaneously, particularly if we face the increasing effects of climate change, rapid urbanization, and growing population. You have said all of this, Mr. Chair. But I would like to just look at this interlinkages demand, which is urgent, and we have a lot of consultation necessary, and I would like to focus on what are the opportunities for Africa. Africa biodiversity and its vast natural resources make it a critical player in global health sustainability. By integrating healthcare with environmental and social factors, we can pioneer innovative solutions tailored to our unique context. Technology and artificial intelligence offers a chance to leapfrog traditional healthcare models, expanding access to remote and underserved communities. Community-driven initiatives also focused on women, young people, and marginalized groups offer hope for building resilience. We have a lot of opportunities, but we have also a lot of challenges. African countries like Senegal are highly affected by climate change with severe health threats like vector and waterborne diseases spread, malnutrition, and displacement. We have also infrastructure gaps and education disparity, which hinder efforts to address climate and health challenges. Food production and pollution are also issues. Prioritizing nutriment-rich food production and addressing environmental pollution, including clean cooking programs, are crucial for improving health and climate resilience. Weak coordination across sectors lead to inefficiency and duplication of efforts. There is also significant lack of comprehensive mapping of existing initiatives and resources. Innovative financing mechanism for climate and health initiatives remains a significant barrier in Africa, particularly for communities. Data management and sovereignty in Africa, which remain a critical challenge. Africa countries must take ownership of their data, ensuring accurate and reliable collection, analysis, and use without relying on external narratives or incomplete information. Finally, the question of governance of this network deserves our full attention, and Africa has a place. In conclusion, Mr. Chair, Africa's participation in global One Sustainable Health Network is not just beneficial, it is essential. It offers us the platform to shape an healthier, more resilient future, one that recognizes the interconnectedness of our planet's health and our own. Thank you very much.
Thank you for this very clear message, Maria. You disappeared, so I had planned to pose a question, but you will get back to us when we have the debate afterwards. So thank you very much. So from one continent, I dare say, to another. So now we have the pleasure of inviting Yongguan Chu to the podium, representing, of course, China. And we will have news from Asia, and I'm excited to know what is happening there. So please, the podium is yours. And you use this one.
Okay. Yeah. Thank you, Mr. Chair. It is a great privilege to be here, to be able to speak to you about our ideas and our research. I'm coming from actually a planetary health background, in particular environmental science, environmental pollution, human impacts, and how can we manage the risks associated with environmental degradation. And today we are talking about establishing a world network of One Sustainable Health Institutes, and I will share some of my ideas. So we all know that planetary health is held as a new discipline. It is really about the co-health of nature and the human. That is the interdependency between the nature and the human. So over-exploration of the nature will cause degradation and also health impacts. So thus this is really a new discipline. And in China, we translate, in a way, the ecological civilization concept is adopted as a national policy. This aligns very well with the concept of planetary health. So this ecological civilization is actually reflected in all policies in China. So it's the highest on the agenda of the government and also local governments. There are two key features of ecological civilization. The first one is about harmonious symbiosis between nature and human. And then the second point is it's called lucid waters and rush mountains are invaluable assets. That means whatever we preserve the natural ecosystem, we also consider the livelihood of the people. So not just for the sake of conservation, it's really to translate the conservation into people's well-being, the health and the well-being. So this is a kind of the national policy we are practicing in China at the moment. And for my research, part of my research is really focusing on this entirety of the ecosystem's approach to planetary health. Particularly, we look at soil, food, environment, health nexus. So all those elements have been studied, and well studied, in fact, but very well siloed. We really have to break down the boundaries and look at the interconnectivity and the cascading effects of one components of this nexus. They will interact with each other, they influence the entire system. For example, we think that the soil actually bridges human and nature, not only through food, but also through the ecosystem health. And also, in case of our daily life, the soil can help assimilate the waste we discharge every day, particularly the organic waste. We must recycle it, otherwise they become the source of contamination and then affect the human health. So our health is deeply rooted in soil via different pathways. Therefore, soil health is critical for both ecosystem health and human health. Therefore, we think that soil if soil is degrading, for example, driven by industrialization, population growth, economic prosperity, urbanization, etc. If the soil is degraded, we must use more chemicals, agrochemicals, to make sure that there is enough food for us. But the overuse of chemicals will cause environmental degradation. They cause their residues in the food, and they will affect our health. So really, soil is the bridge, and we must use this as a showcase to study One Health or planetary health. And I'm from the Chinese Academy of Sciences. We have many institutes working across the disciplinary, looking at planetary health, and my team is closely working with international agencies. So with that, I would like to support the idea of One Sustainable Health institutes across the globe, and we are ready to participate and to contribute with our specific expertise and knowledge and the cultural background. Thank you so much.
So full support from China, that is very clear. And I like that. Health is deeply rooted in soil. That's a very good statement, I think. So we are, as I said, moving from continent to continent. And the next one out is South America. And we are very happy to have Maria de Lourdes Oliveira here from Fiocruz, the Osvaldo Cruz Foundation. And Maria, I'm happy to say we are going to visit you in January, the Lancet Commission on Governance for Health. So I will open your presentation so you can proceed. Here we are. So you use this one.
So good morning for all. Good morning also for our colleague, which is online. Hello and greetings to Oli and all my colleagues from my other panelists. And so, yeah, as Oli was talking about, we live very strange and challenging times. We have many complex challenges to face, and that must be responded under a multidisciplinary way. And then One Health is really critical and is the response for most of these challenges. Yeah, and so I'm a virologist. Yeah, about 40 years in the same institution. Fiocruz is a public health foundation that belongs to the Ministry of Health. And so our main missions, besides public health at all, is science and technology. And on One Health, we have more than 100 researchers working all together in a network organized by our vice presidents. And so one of the questions, one of the questions is how to implement. Is One Health challenging? Of course, it's not something easy, but there's no easy solution. Yeah, about the component, the health component is very well, the human health is extremely well organized, not only in the structure to respond, but in policies for public health. Environmental one, I would say it's a baby compared, but it's also well organized and it's very easy to put both together and make all the evaluations together and also policies. The most complicated component is the animal health. Yes, firstly, because it belongs to other ministry, outside the Ministry of Health or Environment, and you have a huge economical impact. And because of that, it's very hard to do that since we don't have a political decision. And so my idea to bring here is to focus into two aspects. One, the political aspects, that's talking with governance, and the second one is research, innovation, and how to apply that to data analysis and surveillance on real life. Yeah, last year, we just announced that we will have an ministerial committee. This decision was taken by the president of Brazil. Yes, otherwise, to put all these guys sat on the same table discussing to set up a real plan, it's very, very hard. And as I was telling, I work on, besides research, on surveillance for many years, and it's very hard to bring the third component into the table. Yes, and so it was absolutely amazing. There's something strange, but okay. This year, finally, the decree was published, and so we have an interministerial working group, and our mission is really to set up a Brazilian plan for One Health. And then it will involve since research and development through surveillance, and even this committee is coordinated by the Minister of Health, by the Health Secretariat, and it's extremely important to be like that because surveillance is one of the most important applications into One Health field. So we have about 80 ministries sitting on the table under the coordination of the Minister of Health, so agriculture and livestock. This is absolutely essential because that's the most difficult component. Environment, climate change, science, technology, and innovation, defense, of course, because we have the pandemic threats, and they are also involved. You have bioterrorism and so on. Agrarian development, education, and foreign affairs. And besides the ministry's representatives, we also have about 7 federal institutions which are connected directly to these ministries to really have not only a political view, but also the technical, how to do that. And moreover, our councils are sitting at the table too. Unfortunately, it's quite new, I would say. We had already 2 meetings, and the third one I would not be able to be present because I'm here. And so the second component I would like to focus is, yes, it's possible to be done. Yeah, and so only to make a context, at this we have dengue epidemics normally in Brazil, yeah, for every 2-3 years, but in 2024, it was amazing. We have more than 6 million cases, and besides the magnitude, we have anticipated epidemics, yeah, too much more earlier than we would expect. And it's a challenge to prepare the primary care, to prepare attendance to our patients, and so on. And so in Rio de Janeiro, we had a totally different profile. Why? Because we are modeling all data. And so if you look here, the Brazilian deaths were about 5,000. In Rio, it was 20 persons, unfortunately. And why that? Because of surveillance, yeah, of the Health Secretariat surveillance. And one of the tools that I would like to bring to you, it's already under use at the Ministry of Health, is called InfoDengue. And so in Brazil, we have a national surveillance database, yeah, an information system. So it makes it easier to make huge analysis for all population and even to see the regional patterns and so on. And so our specialists were developing the system. It's for all arboviruses under circulation in Brazil. And so besides mapping hotspots and so on, for the state, the country, for the state and for the cities, we can really control. More than this, they are also collecting climate parameters. And so it's very important as an indicator of a good environment for entomological control, because after a temperature, you have increase of vectors. And so combining all together, they are setting out, they don't call forecast, but nowcast, because it's in real time, yes, the thresholds and where the surveillance must really intensify that work in the territories. And so I would invite you to visit the site of our Health Secretariat, because this is only one tool. There are many others. They are modeling everything. And that's why we had so small number of deaths in Rio. And so I would like to thank you very much. and of course the team of the Ministry of Health, our One Health coordinators, and also the Infodengue team that from Fiocruz, especially to Osvaldo Cruz, because their work helped us to save lots of lives in Rio. So thank you very, very much.
Thank you. And what you said about the connection to climate is so relevant. It really shows that we have to have a One Health approach to health. So yes, the next continent, I would say, that is on the agenda now is North America. So as I said, we are collecting cases and status reports from all over the world and now to North America. And Keith Martin, you are the director of the Consortium of Universities for Global Health. So we would like to know what you have to say. So please take the podium. Let's see here. It's not showing. Let's see.
Thank you, Ole Peter. Good morning, everybody. Bonjour à tous. Guten Abend. That's as far as I get on my polyglotness. Before I want to start, I just want to we would not be here without the enduring efforts of Benoit Mirabel, Dr. Brian Rudkin, Dr. Detlef Ganton, Casimir on the team. Can you stand up, please, if you're here? Good morning. Good morning. There you go. So they have been tireless in bringing us together, and without that leadership, we would not be here today. So from the bottom of my heart, I'd like to thank you very much for all what you're doing. The one thing I'd like you to remember before you leave here, and there's only one thing, is please join the One Health Institute closest to you. So whether it's the European, the Chinese Institute, the Asian institutions, the Latin American institutions, David's work at the WHO Academy, please join, because we cannot do this together. So what I wanted to do with this short talk is really give you the bad news, but also the good news, because there's a lot of good news and things we can do. And I'm going to focus on action and impact. So the bad news, you've heard we have a triple environmental crisis: climate change, biodiversity losses, and pollution. They are ripping apart the fabric of all life on Earth, including our own. And the other side of this coin is that the rate of our action, as we know, is far, far slower than the rate of decline and decay. And I think all of you, in our lives, if you watch just the biodiversity in our lives, the decline, you can see it, right? Less butterflies, less insects, less birds. That's not your imagination, that's a reality. But policymakers don't fully grasp this, or their urgencies are somewhere else. The good news is that what we can do is we can deliver initiatives that actually address all three of those together at the same time and deliver political gains and that align with the political interests of politicians. In other words, we can deliver and address the social determinants of health. Why is this important? Now here's the good news, is that if we're going to be able to address this gap, and I think all of us know, right, we're all involved probably in science in some capacity, we have a mountain of science, a mountain of evidence, right? If you remember the scientists at the UNFCCC, when they said, dear UNFCCC, please give us more evidence on climate change and more research on climate change. It's like asking for more research on smoking and cancer, right? They said, no way. Unless you act on what we've given you, we're not doing any more. So let's get that done. We have to bridge that gap between the knowledge we have and action. So where is the agent of action? The agent of action is actually political, right? These are political choices. And the place of action of greatest impact is actually at the lower levels: communities, cities, states, national governments. The biggest impact is actually at a local level. And those folks, those leaders, are looking to you to be able to help them, They need your help. So I think our job is actually to reach out to them to do this. So we've got the triple environmental crisis at the top. But if you think about it, if you're a mayor, if you're a provincial leader, if you want to be able to deliver this, what do you have to have? You've got to have a competent public service underneath you, right? You've got to have the people who have the knowledge, the capacity, and the resources to be able to deliver those. The other side of the coin is that their timeline may not be our timeline, because they're working in short buckets of electoral timelines that align with their interest, which is what? To get elected or re-elected. We have to work with that timeline, and we have to understand it. So with that, there's two parts of this. Number one, particularly in lower resource settings, and Anne-Marie Colsec could obviously speak far more powerfully than I could. But a lot of political politicians and governments, they have a lack of public service strengthening in their ministries and in their departments. We can work with them to help them, right, in little but important ways. So I'd encourage you to reach out to them and listen to what they're asking and build those relationships to help them in that space. The second thing is to be able to get their long-term political commitments. Because unless they deliver with you concrete political commitments, all the wonderful research we're producing isn't going to be implemented. So we've got to secure that, which means we've got to show them benefits for people in their communities. Finally, I just want to, Finally, I just want to say, in the institutes that we're talking about today, there are really 4 objectives that we have: training and education, finance, public awareness, strategy, and governance. And by governance, I also mean going back to strengthening the ability of governments at different levels to be able to deliver the public goods that their folks need. So I think part of these One Health Institutes is a mechanism for us not only to work together internationally, as you're hearing, but also for us to work with you, to work with your institutions, to share your knowledge, to build those relationships up, to show governments the value of action and the cost of inaction, which I think is largely underappreciated in the whole equation. If you do that and show the benefits of what you're asking for are doable, affordable, effective, and deliver outcomes for people, health, jobs, the economy, then we will be able to impact the triple environmental crisis that we have before us. And finally, I just want to invite you to come to our conference in Atlanta. Shameless plug for the Consortium of Universities for Global Health. It's in February in Atlanta. Please take a look at the website. Please take a look at the work we're doing on capacity building and our other work in the One Health space. So thank you for your attention.
Thank you. Thank you very much. And the long-term perspective, that's essential. And that is, of course, why we are struggling a bit, because, well, I think it's safe to say that many political decision makers, they don't share exactly our long-term perspective when it comes to the issues that we are discussing now. So now we are switching to Benoit Miribel. And there is no presentation here, but I guess... So perhaps we could get some help from... do you have any presentation here? No? Okay. Benoit, it seems that you have to manage without. But I should say that echoing Keith, Benoit Miribel, he has really done so much to get One Health on the scene. One Health center stage, I would like to say, also when it comes to politics and political decision makers. So One Sustainable Health for All Foundation, among other initiatives, is very much yours. And Brian Rudkin again, where are you now?
He's in the kitchen.
He's in the kitchen.
Brian.
Together with Brian Rudkin, of course, so much has been done in this field over the past few years. So I leave the floor to you, and I'm sure that you can manage without slides, Benoit.
Yes. At least I have one picture. This is, what was done by all the expert committee in the network. We launched, by the way, 4 years ago, thanks to Detlev. Yes, Detlev is here. We signed an agreement when he was the chairman of the World Health Summit to create a forum, one sustainable health forum, because we were hearing a lot of scientists, experts, especially due to the pandemic, discussing about what was happening. And now we have the proof. It's clear what was mentioned, especially by our Marie Colsec from the field, Maria Lourdes, our friend from China, Keith. So we know that we have to adapt, accelerate, that we are responsible of what we are doing, and we need to involve the civil society. That was the important decision, I would say, from one of the most important decisions, maybe Detlev, to give credibility to this forum made by NGOs, foundations, companies, of course, academics, universities, because we consider that we need to be all together. There is no one health if there is not everyone on board, public, private, with the expertise. Easy to say, but very hard to do. Like, in the kitchen, maybe what you need to put to make a success with the cake, but how to do it really, it's always difficult. So step by step, we move little by little. So this is a picture of a document that was made by expert committee in international working groups. We can mention Davide also. He's here, one of the strong participants and leader in the working group.
As if by magic, now the slides.
Yes, the slide are here, yes. But I started to speak, so I will not be too long. Just to go, by the way, at the end. So, yes, we have the forum, and we were invited during the French presidency of the EU in 2022 to be committed. And we, together in Europe, we were able to issue Building European Health Union. We know that health is not a shared competence for the moment with the member states. A lot of progress have been made. And this is with this coalition that we are able to have all the experts. And we follow Peter. We were, you have a picture. We were invited to meet with the health ministries at this occasion. And I would like to thank, because all this is a story of person committed. It's not the organization for the moment. It's Detlev, it's Jérôme also from the health ministry in France, Karine Sipido, and many of you that are committed here that help to work on what we need to shape, and it was very well explained by you, Keith, what we need to do to accelerate. And so I will just, yes, after the launch of this coalition, One Europe for Global Health, and we were able to discuss with the Commission, and I need also to mention Clement Sauer and Dorley from the European Gastein Forum, also really committed. So it's a convergence of knowledge, of capacities together. And so every 6 months we move across Europe, and we will be in Budapest on November 20th at the occasion of the World Science Forum there. When you were the president of Karolinska, we were in the Nobel room, so it was very important for the credibility. So we were yesterday at the French embassy with One Digital Health, because as you mentioned, Ole Peter, data is a crucial issue that we know. And we would like now to propose, just to remind that the approach, One Sustainable Health, is not mine. It's the approach from many scientists who agreed about that because they wanted to somehow to link the One Health approach that exists for secular with SDGs. So we consider we have the SDGs that One Health, planetary health. Of course, I'm not a scientist, I'm not an academic, so I'm speaking more about the implementation. And we consider that now, this is the time, and this is why we are today, to launch a task force. Of course, a lot of things are moving in Europe, especially academics, but we need to have a global task force that includes the civil society, as it was said by our Marie Kolsek, also the community, driven community, because we need to accelerate. So everyone heard every day on the radio, the TV, we need to accelerate climate issues, health, etc. So, okay, so now we need to see how it could work. And that is an announcement. We will be next year for our conference about health, environmental and social issues. That is possible thanks to AFD, the French Agency for Development, with Pasteur Network and all our friends. It will be the occasion to give the results of this task force. So we will launch the task force and see in July. And in the meantime, in 2 weeks, we will be in Dakar for the forum One Sustainable Health by All, because Professor Awamari Cole said it's not only a message for all, it is by all, very important. So it will be in 2 weeks, and it will be the occasion also to discuss about that point. Thank you.
Thank you, Benoit, and again, thanks to Brian for sorting out the problems with your slides. So without Brian, nothing would work, I would say. So then, if you remember, and I guess you all remember from my introduction, training, education, important aspects, I would say, of the One Health scenario. Without education, well, we won't make progress. And then it's a great opportunity and honor to introduce David Achavarena from the World Health Organization, the WHO Academy. So I guess that training education will be on your agenda now. Please, take the floor. Yeah, you have no presentation, that's true.
Thank you, Ole, for this introduction. Good morning to all. First of all, I would like to thank the organizers, Ole, Benoit, Brian, for inviting me to speak at this session. Actually, I was here a year ago when a first session was organized to start actually reflecting on this concept of a One Health European Institute, and it's pleasing to see all the progress that has been made since last year to actually bring forward this initiative. Maybe I'd like also to congratulate and to kind of stress the fact that education and training is at the core of the initiative. Ole, you mentioned it. This global network of One Health Sustainable Institutes would have really a strong emphasis on education and training. Public knowledge is one of the 4 pillars of the initiative, and the One Sustainable Health Training and Education is also one of the 4 areas of focus. So this is why also you understand that it's quite a pleasure for me to be here. I mean, the WHO Academy as a new also initiative of WHO to reinforce, strengthen, consolidate the learning initiatives of the organization, and primarily towards the global health workforce, will be one of the partners also to actually contribute to make those steps and progress in the field of One Health. But maybe let's reflect first on, what is the status of One Health in education and training today. I think that when we look at the situation in most countries, we can say that it's still very fragmented. It remains really in silos, in the medical education, veterinary medicine environment. The curricula do not really refer to the other fields of knowledge. So although One Health is not a new concept, its actual integration in education and training is still very limited. What we can see also is that typically veterinary medicine is a little bit ahead. And we see that there are more, elements being, integrated to refer to human health and to environmental sciences. And environment is often left aside. So the One Health is actually approach is often working only on two legs. So I'd like to maybe recall some of the important principles that need to guide really the development and education and training initiatives in this area. Maybe just to refer to the importance of linking One Health to this reflection on the complexity, the importance of complexity and how to address complex issues. I mean, this was very much discussed in the context of the development of the Sustainable Development Goals, but it's of course also very, relevant and important for addressing One Health issues. And it means that transdisciplinarity is really a key principle that really should guide all the efforts for developing content, including in the field of education and training. We heard with Professor Zhou how this is actually being implemented in China. I think we have a very good example. It needs also, in terms of operational work, to be intersectoral, interministerial. Again, we had a good example with Brazil, with this One Health interinstitutional committee that has recently been established, and it has to be pluridimensional, national, but also local. And again, Keith, you insisted on the importance of the local level. So this is really, I would say, the broad principles that need also to guide the work in terms of the development of learning materials and programs. The WHO Academy has decided to actually dedicate a specific effort on One Health. We have what we call a flagship program on One Health, which will, to a large extent, complement and support other initiatives of WHO in this area. First of all, in relation to the prevention of zoonose, and this is linked in collaboration with our colleagues here of the WHO hub in Berlin, in the field of field epidemiology, and in particular through this concept of collaborative surveillance that needs also to actually be strengthened through adequate capacity building initiatives. It's also related to AMR, antimicrobial resistance. That's another, top priority of WHO, for which the WHO Academy is going to develop also a number of initiatives and programs in the field of learning. Data, again, that's another area, and here in particular in connection with data laboratories, and this is something that we will be doing with our colleagues of the WHO office in Lyon. And finally, the local level, again, cities is a dimension which is key, and we have a good example of this through an initiative by our host city, the city of Lyon, which leads an initiative to mainstream One Health in all areas of public policies at the municipal level in different cities in Europe. And then finally, to end, I would like to recall that this flagship will also take place within the framework of the quadripartite initiative, associating FAO, WHO, UNEP and WOHA, which just launched a new initiative on learning for One Health that will include different components in support of the so-called joint action plan adopted in 2022. Thank you.
Thank you very much. Thank you very much, David. Education, training, very, very important aspects of it all. So, interconnectedness. Miriam, we are interconnected geographically, absolutely. We are interconnected with animal life, the planetary health. But we are, as our generation, also interconnected with future generations. Imagine what kind of responsibility we have for not only the next generation, but the generations thereafter. So we have, I'm sorry to say, my voice is not really representative of the young generation, but now there will be one. Miriam, it's a pleasure to invite you to the podium. Miriam Meyer, you are here to represent the voices of the next generation. Wow. But you also represent Generation Europe, which is a network that perhaps you could tell us about. So please come to the stage.
So hello everybody, thank you Ola Chair, thank you participants of the panel, and also to you for being interested into the One Health topic. So my name is Miriam Meyer, I'm a medical student at the Charité in Berlin, but I'm also part of the Génération Europe, which is a French-German youth network of 24 young professionals and students from France and Germany. So the program was launched in 2023 and managed by the German and French Joint Youth Office, and aims to select each year a multidisciplinary group of 24 young people from different fields. So we are students, we are teachers, we are researchers, we are coming from different fields, from academia, environment, private sector, public as well. So what we do is we want to build bridges between France and Germany, but also in a broader sense in Europe, which we do through political reflections with talks and encounters with people from the parliament, from researchers, think tanks and politicians, but also in joint work. So last year's cohort presented their recommendations to the French and German parliament and also to stakeholders in that field. And the second cohort, which I am part of, is the Génération Europe 2024, and we consolidated this effort by actively discussing in panel discussions, organizing workshops, and we, interestingly, because we are such a diverse group, we teamed up and formed working groups on different fields, which we also presented on the occasion of the state visit to the German and French presidents. And so we were working on, we highlighted and encouraged further developments to the exchange of young professionals between France and Germany and Europe, but also more eco-responsible mobility, a joint cultural platform, and where we come in the call for One Health Institute in Europe. So aligning the efforts that there already are in France and Germany, but also in other parts of the world and in Europe, to work together to consolidate their efforts and also to make immediate progress, which will be then leading on to further developments and long-term effects that we so much need also in terms of young people thinking of the future that we'll have together. And for that we wrote together a concept paper with members of the Virchow Foundation and the Coalition for One Health, and we and I think also because I'm a medical student, I'm a student, but we teamed up with so many different kinds of fields. So it's not just one discipline, it's so transdisciplinary and it's across borders, and that's why we think it is important to work together. And I also loved, Benoit, you mentioned that one sustainable health is just one sustainable health if everybody is on board, and you mentioned policy, you mentioned the public, and you mentioned experts. And I would also broaden it and say, yes, we also the youth part of it, and we're dedicated to work together and to make the future together with your expertise and the policymakers in the room. Thank you.
Thank you, Miriam. Needless to say, we need the voice or the voices of the young generation. And it was a real pleasure when we had the Video Prize lectures to have young physician leaders in the auditorium, in the audience. So whatever we should do for the future, we should listen to your voices. So thank you very much. So I will deviate from the program now. Brian, you're looking at me, but please forgive me. We are running a bit behind schedule. So instead of posing questions to the individual panelists, I think time has come to involve you, the audience, immediately. Brian, will you forgive me? Of course, I'm forgiven. But before I include the audience here, is there any representative of the Lancet One Health Commission here? No? Okay, because I had hoped that we could get a dialogue with this commission as well. But one thing that I hope will be in evidence in this discussion is what we have left out. Because you're all so disappointed. Where are the institutes? Where are the physical buildings? Where are the brick and mortar constructions? They are nowhere. So I do hope you understand that an institute is it's a sort of symbol for what we're trying to achieve. To bring the different domains, sectors, disciplines together. Not necessarily in a new building, but in governance, in research, education. That's the point. And in surveillance and intelligence. So you have to interpret institute in that way, not as a brick and mortar structure. Of course, we have nothing against it if there will be physical structures, but it's not necessary in order to achieve what we are discussing here. Benoit, do you agree? I hope you agree.
Yes, yes, I agree, of course. And it's true that last year we were here at the World Health Summit having a side event, an open discussion on it. And at that time, it was just, a discussion, general discussion for those who were attending this discussion. So we make progress, and I would say that it could be only with an already existing institute. Yeah. So the question is the interlink. We are not going to build a building, a new institute. It's not that we need. It's the interlinkages.
Exactly.
It's building networks of networks and involve all actors. It's theoretically possible because we have IA, so we should have the solution. We ask the machine if we are not able, the human, to do it. But this is what we need to really do it. Having leverage on the already existing institute, but they are in silos. Yeah. Because it's true that if you look to the United Nations, FAO is doing One Health, WHO is doing One Health. They are all doing One Health, which is good, but where there is a space that we all share priorities also. So we need this verticality. We need all discipline. We know that, but the question is horizontal.
Yeah. Just one thing before the first question here. Please be reminded that, yes, we have been addressing governance at a pretty high level now. At the domestic level, national level, regional level, even the global governance level. But yesterday I was in a meeting that reminded me, that Detlef Ganten organized it, that perhaps one of the most important governance levels in the time to come, when it comes to One Health, will be the city level, urban planning. Because the population living in cities will continue to increase. And cities are the ideal playing ground for assessing the interconnectedness. Not so much with wild animals, obviously, but certainly with climate, with environment, and this kind of thing. So thank you, Detlef, for organizing this very interesting meeting yesterday. Now, please, there is one in the back. Please identify yourself, institution name, and then we get going.
Yes, my name is Meyir Zieka. I'm a wildlife epidemiologist from Ghana, and I'm here collaborating with the Ghana Health Service. So, my question, anyway, before my question, I would want to tell you that city dwellers are also quietly related to wildlife Because in Africa, where I come from, people in the city eat what we call bush meat, which are harvested from the wild and brought there. And therefore, that interaction is a way of spillover of zoonotic pathogens. But then my question is to the presenter from Brazil. In your presentation, you said that the environment sector in the One Health framework is quite well organized than the animal health sector, if that is what I heard. In my country, I think it is the opposite. The animal health sector is well organized because according to WOA pathways, we know what the animal sector is. The environment sector is what is not well organized. So I want to know from Brazil, how did you define that and how did you get it right? Thank you very much.
By the way, before we pass the question to the panel, could you, in the back of the room, invite Ava Maria Kolsek back on? Oh, okay, I will ask her. Could you please turn your camera on? Ava Maria Kolsek. Okay, now, who will respond to this question?
Yeah,
Of course,
I
you
can
should.
respond. Yes. Thank you for your question. In fact, maybe I was not expressing well. The animal is extremely well organized, but it's not so connected to the human health or environmental as the last two ones. And so, in fact, it's easy to access data from the human health, from environmental health, but not for the animal. It's like they are part. And what's changing right now is that after a political decision, they are coming to the table. So hopefully next year we'll have more news about that and how it was working out. Yeah, and so sorry if I was not able to express clearly, but that's it. It's like in Africa too, yeah? Thank you.
Yes, I think next question was here, I think.
Thank you very much. Roland Hansen, Maltese International. I have a question to Keith regarding the implementation gap. So we have a lot of knowledge, a lot of policy. I'm happy that we have it, but somehow the implementation part is lagging behind. Is that correct? And if so, how does this new idea of this network of universities mainly help to close that gap? So we are ready as a civil society organization. I really pushed personally also that One Health is now a topic within the organization, but it's also sometimes lacking the funds to do it.
Perhaps Keith could respond.
Thank you very much. It's a fundamental question. So this is actually to the funders, right? Goes to your question. You have to incentivize this action, because unless you incentivize the action is not going to occur. So there's a real opportunity, as you alluded to for funders to be able to, which I think is a largely underappreciated endeavor on their part, fund local institutions to engage with their local governments and their local provinces and federal governments. More important, particularly regardless of the country, and particularly for low-income countries, there's incredible work that's obviously being done in their institutions, but the funders need to help to incentivize those actions so that the academics can have the resources to engage with the politicians around very focused areas. So what would that be? Management, monitoring and evaluation, infrastructure, and then being able to translate and engage and strengthen the needs that the governments themselves say that they need. They'll tell you what they need, but as you said, we have willing actors on the academic side, needs on the other side, but the academics also have to reach out to governments. That's not done very well. And if the funders also do that, that would be outstanding. The one action, if I may say, that would deliver all three of these, address the triple environmental crisis and produce tangible political benefits, is actually to protect the identified critical biodiverse hotspots that the International Union for the Conservation of Nature identified. These are science-based identified areas. They represent less than 5% of terrestrial land mass and also marine ecosystems. Those are the where to do it. And then if academic institutions can assert that with governments, they can actually protect those areas, invest in local community training to manage those areas and deliver money, resources, jobs, and finances, and also protect the critical ecosystems on food, water, climate change, because there's a huge, obviously, carbon sinks and other ecosystem services. So it's a massive win-win situation, but it's going to require some leadership, and we all, I think, have to assert with funders to get in the game and fund this, because they're not doing it right now. Thank you.
Thank you very much. Before next question, I would, since Ava Maria back, so please, if I may ask pose a question to you, Ava Maria Kolsek, before we again let the audience in. You used a word that is pretty ambitious, but I think ambition is in place. You used the word leapfrog, that in your country, or perhaps many places on the African continent, you could leapfrog the traditional governance systems for health. Wow, that's quite a statement. Could you elaborate on what you mean by leapfrogging traditional systems for governance for health? We need the sound, please. Yeah, you're muted. Sorry.
Okay. Thank you. Thank you, Mr. Chair, to go and respond quickly to your question. In fact, we have a lot of opportunities to not to wait like other continents have done often, to have real problems, to create the links. We can use their experience and have in Africa a more quick response. And this is why I say that we have learned, and it is why Africa can play really now a role of leader when we look at all this issue of climate change and one sustainable health. And we have been working hard at the level of government with a lot, if I take Senegal, a lot of structure at the highest level, at the prime minister level, coordinate the work of all the ministers. And this is very helpful because people were working in silos. Now, with this structure, it is possible to work together. But also now more actors, because locally we have also mayors and governors who are very involved. I am just coming from Nairobi to a meeting of AMA, who is working with all the mayors in Africa. And it is also a very important work on urbanization, all the issues on communities and climate change, etc. So I think that we can really now go very quick and be leaders if we look at One Health and all the issue of climate change. We are a continent, Africa, who are doing the less pollution, but more affected. And because of that also, we need to go quicker. And the issue of leapfrog is why I was using this word. Thank you.
So to paraphrase a famous American president, look to Africa. That is the message. So now we go back to Dons. I think the first row here was the first.
Thank you. Thank you very much, Amir Takian from Tehran University, Iran. Fascinating panel. My point is about equity. Yesterday, the Nobel Prize of Economics was awarded to guys who worked in institutionalization and institutions. Institutions matter. In the low and middle income countries, we have a double burden. One is understanding One Health as a concept for which we need to have a good governance. But the second burden, which somehow exacerbates the situation, is the lack of institutions, and institutions in a way of harmonized function to address this very challenging issue. So my point is, in line with inclusivity and equity and having the whole world working together, because it doesn't make sense that only high-income countries concentrate on that. We need to work more on the context of low and middle-income countries. How we can make sure that this effort in that context is robust enough to help to institutionalization of this One Health, not just the institute which address One Health. Thanks.
So who would respond to that?
I can, and maybe
I would suggest that Maria and And also, Yong Guan-Chu could respond to this. Maria first, please.
In these complex times, I would say assure something. It's really hard. Yeah, I think, of course, it's not something that must be organized by one institute, but by a network. And as bigger we are, as stronger we are, and in the way we involve community, the community engagement, I think that's something key, because they are voting at the politicians. And so the politicians will regulate the theme, and the executive power will have to do it. And so I think it's still a way. Yeah, but it's really key, and I guess we are making One Health, and I think Benoit had spoken about, Brian, of course. We don't map exactly all the One Health task force we have globally, or even locally. And so we must start, and that's it. But we must start and show that it's feasible. It's not anymore a concept discussion. I think this was a problem for a long time. Since you are able to really show outcomes, yeah, and just here we have a sample of that, and it's too much more bigger than we are, then even it's easier to get funding. I think the funding problem is sometimes is the lack of objectivity, and so for whose funding is very hard, they want to do. But for example, if we listen to African development in this area, it's fantastic. And congratulations, I would like to say the same about South America, but we are not so integrated. And it's absolutely perfect and beautiful because it's a network. It's the voice of a continent. I think in this way we should really move.
Speaking about move, we are moving into a very intensive phase, you know, because there are many questions and we should have short questions, and I'm sorry, short responses to cover everything as democratically as possible. Sung-Chu, please.
Yeah, thank you. I think it's a good point. In my view, collaboration is the key. How can we share knowledge across countries, across regions, by educational program, capacity building programs? I think this, and that is actually, I think, the network we are talking about is really part of that effort to mobilize the resources that we can work together at a global scale. Thank you.
Now we take 3 questions in a row. I think we should start in the back there. There are at least 3, and please be reminded there are 3 up here as well. We try to accommodate all questions to the best we can. Please.
Thank you, Mr. Chair. John DeYoung, I'm president of the World Veterinary Association. I was intrigued with Miriam's presentation. I wonder how many veterinary students are here. And I would, there's one, great. And I would hope that since this is the World Health Summit and we're talking about One Health, progress is being made. And I have to commend David for saying the veterinary medicine is way ahead, because we are. So I would hope that the World Health Summit, if we're going to really talk about world health, which is human health, animal health, and environmental health, that those players are brought to the table here next year and in the years to come so that we can all work together, because the progress has been slow and tedious. I was exposed to One Health about 20 years ago, and veterinary medicine has embraced it. I really do hope that we stop talking the talk and walk the walk here so that human health also completely embraces One Health. Thank you.
We continue in the back, 3 questions at a time now. And point well taken.
Hello everyone, my name is Pragati Gupta. I'm from India and I'm representing one non-profit organization, the Hues of the Mind. My question is, how can we redefine global collaboration to ensure truly unified and resilient network of health institutions that address systemic health inequalities? Thank you.
Thank you. And one more, and then we can get the panel in. There was one more in the back, please.
Hi, my name is Sarah Eitzer and I'm from the Institute of Planetary Health Behavior. So my question is about the behavior of people, because if I was wondering if there are any educational materials for the politicians that have actually to communicate their decisions to the normal people, because as human beings, we are not always acting rational, and we have to make sure that people are accepting these changes to increase One Health or the world health, and that they don't work around political decisions. So, is there any training to the local politicians or the global politicians even to communicate to the people that have to support these decisions?
David, that's a question for you. How many politicians are you aiming for in your educational systems?
Thank you. Education is, of course, key to change behaviors, but it's not the only parameter. So I think it's important not only to develop and promote, I would say, One Health literacy for decision makers. I mean, this is something that we are planning to do as well. But it's also important to reflect on how to actually adopt and adapt, education materials so that it can take into account cultural factors, but also, socio-political factors that are key also for explaining, whether or not things are moving in the right direction. So indeed, it's an important element, but it has to be actually integrated in a broader, framework. I'd like also to say just a few words about the questions about inequalities, and also, refer to the previous one. I think it's important also to note that in the recent intergovernmental discussion about the pandemic treaty, One Health was an important topic, and it was also one of the topics that actually prevented from reaching an agreement among member states. So while there is a wide recognition, of the importance of One Health and in changing policies in that direction, there are also conditions for this to be in place, and in particular, how to support countries that have already, I would say, fragile health systems and poor resources to be able to actually implement in an effective manner the One Health approach. So, this is also an important element to take into account, how to change international cooperation for global health so that, the One Health approach can be really implemented globally.
Thank you very much. Is Till Berninghausen here now? No, okay. Because he is directing the EGRIN network, which is in fact a network that should be able to respond to some of the issues that have come up here. One of the networks that I think we should take into account when we develop the One Health concept further. Yeah?
Yes. I'd like to ask Jérôme Weinbach if he could present briefly the effort that he is doing to try and get communication among European states and people who are the players. Jérôme?
Please shorten, because I think we should have a last question to Ava Maria Kolsek.
So I'm representing the French Ministry of Health, but also I'm coordinating the European Joint Action to maximize the impact of the EU Global Health Strategy. We have started a project last year, and of course, One Health is in many global health strategies of various member states of the EU, and it's also in the European Union global health strategy. So we try to coordinate all stakeholders at national, but also territory-based level and European level to coordinate our actions, to be more inclusive also with the civil society engaged, and to work with other regions of the world. This is extremely important. I would like to invite your network to participate in the joint action number 2 that we will prepare next year. And remember, we have to prepare also the next EU Global Health Strategy, and One Health should be integrated at the center of the next EU strategy to cooperate with Latin America, Africa, etc. I just want to quickly mention one thing with the cities, because that was a very important aspect. In France, the members of our parliaments, particularly those coming from the African diaspora, have launched a network of local elected officials to work on these global health and One Health issues against malaria. You know, the fight against stagnant water with a good collection of garbage and dustbins. Every day, avoid malaria. And we can see how a mayor can play a role in global health in One Health approach, because it's about rain, mosquitoes, and of course human health. So this is a typical example you should build in. Thank you.
Thank you very much. Time is running, but I'm very sorry, but we have to come back next year. Till? No? Where's Till here now? Yeah, there is he. But very, very short, because I have a question. No, you could come here, but 1 minute. Because I have one question to Ava Maria before we close.
Thank you, Ole. I'll be super quick. Apologies, I had to step out for an EU review. So I'm Till Bernighausen. I'm leading the Heidelberg Institute of Global Health. We are a large research center in the faculty at Heidelberg University, Germany's oldest university, 1356. And the contribution that we want to make, and we are very happy to join. And I saw that this is really a contribution where I think we're filling a critical gap, is the science of intervention. So already working more from the human health side into the One Health sphere. What can we do now that will have impact very soon? And examples here are adaptation research that we do. We are testing the cool roof and the eco-cooler in Burkina Faso and Bangladesh. We are testing novel ways to boost zoonotic spillover literacy in communities in Cambodia and Cambodia. So we're doing climate change adaptation work in Europe. We do the sustainable nutrition interventions to reduce our carbon emissions and greenhouse gas emissions. So we're working on the adaptation, on the mitigation agenda, on the prevention and preparedness agenda, more on the pandemic and humans in our togetherness with as microbiota, as Brian reminded us yesterday, we are the microbiota or microbiota that has agency in the human Earth system. We have agency, unlike animals and plants, so we need to act and we need to work on interventions and policies.
Until we'll tell you much more about this in the corridor after the meeting. The last question to Ava Maria Kolsek. You have been a health minister. This is a provocative question, of course, Ava Maria. How should we ensure that from now on there will be just one health ministers?
I can speak on experience, because when I was Minister of Health in 2016, we had a meeting with other ministers, agriculture, environment, all the ministers we need on One Health in Senegal, coming from all the West African countries. It shows that we need to work together. And it is just to say that Minister of Health can lead to call others, give them place, but it is important to have what I said, this interministerial coordination with the Prime Minister office. I think it is very important if you want to have concrete things, but not link it only to government, but also civil society, community, private sector, because all academics, all need to be involved. And this is possible. It exists in a lot of countries. We need just to strengthen it and consider that it is a way to for One Health. Thank you.
Thank you very much. And now thank you to the audience. And I'm so sorry, there were several questions that could not be posed. This is because of the time constraints, not because of the lack of interest on the part of the chair. So thank you very much and have a good day.